Welcome to today's video about symptoms of pancreatic cancer. Have you ever wondered why some of the deadliest diseases go unnoticed until it's far too late? Why do symptoms that seem so small, like back pain, fatigue, or just feeling off, get brushed aside, even by doctors? Here's the truth. Pancreatic cancer is one of the most aggressive and silent killers out there. By the time it's diagnosed, nearly 80% of cases are already in advanced stages. Globally, over 495,000 people are diagnosed every year, and it's responsible for more than 466,000 deaths, according to the World Health Organization. That's nearly one person lost every minute. But what if I told you there are real warning signs, symptoms that research has already identified but are too often missed or misunderstood? In this video, we're breaking down 15 symptoms of pancreatic cancer, all backed by medical studies and expert-reviewed journals. Some of them might surprise you, others might make you pause and reflect. And the 14th symptom? It's one of the most overlooked clues that could change everything for early detection. We're not here to scare you. We're here to empower you with knowledge, because the earlier you recognize these signs, the greater the chance of survival. Stick with us till the end, because we're also sharing what recent studies say about who's most at risk, and what you can do to stay ahead of it. Before we dive in, if you're passionate about taking charge of your health, hit that like button and subscribe. We post science-backed health content every week, and we'd love to have you join our community. Drop your country in the comments. We want to know where you're watching from. Let's get started, because the knowledge you gain today could truly save a life. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. All right, kicking things off, here's what to look out for. Starting with symptom number 1. Abdominal pain. Pain in the upper abdomen that radiates to the back is a common symptom of pancreatic cancer. This discomfort often intensifies after eating or when lying down and may be alleviated by leaning forward. The pain arises due to the tumor pressing on or invading nearby nerves and organs, leading to a deep, gnawing sensation. A study published in the Journal of Gastrointestinal Surgery in 2001 found that patients with pancreatic tumors invading the anterior pancreatic capsule and intrapancreatic nerves experienced more intense abdominal pain. The severity of this pain was also associated with larger tumor sizes and lymph node metastasis. Notably, the study reported that patients without pain had a median survival of 29 months, while those with severe pain had a median survival of only 9 months, highlighting the prognostic significance of pain intensity in pancreatic cancer. If you're experiencing persistent abdominal pain, especially if it's accompanied by other symptoms like weight loss or jaundice, it's important to consult a healthcare professional for a thorough evaluation. Next, number 2. Loss of appetite. Imagine sitting down to your favorite meal, but the thought of eating makes you feel sick. This isn't just a bad day. It's a reality for many facing pancreatic cancer. The pancreas plays a crucial role in digestion by producing enzymes that help break down food. When cancer affects this organ, it can disrupt enzyme production, leading to malabsorption. This means your body isn't absorbing nutrients properly, making eating feel pointless. But there's more to it. Pancreatic tumors can release substances that interfere with appetite regulation. These substances can alter signals in the brain, making you feel full even when you haven't eaten. It's like your body's hunger cues are being hijacked. A 2019 study published in The Oncologist found that up to 85% of pancreatic cancer patients experience significant weight loss, often linked to decreased appetite and malabsorption. This isn't just about feeling less hungry. It's a complex interaction between the tumor, digestive system, and brain. If you or someone you know is experiencing a persistent loss of appetite, especially alongside other symptoms like weight loss or fatigue, it's essential to consult a healthcare professional. Early detection can make a significant difference. Next, number 3. Bloating. Ever felt that uncomfortable, swollen sensation in your belly after eating? For some, it's just a passing discomfort. But for others, especially when it lingers, it might be signaling something more serious. In a comprehensive study conducted in the San Francisco Bay Area, researchers found that 25% of pancreatic cancer patients reported experiencing unusual bloating, compared to just 2% of individuals without the disease. This translated to an odds ratio of 20, indicating a significantly higher likelihood of bloating among those with pancreatic cancer. So, what's behind this bloating? The pancreas plays a crucial role in digestion by producing enzymes that help break down food. When a tumor disrupts this function, it can lead to digestive issues, causing food to remain in the stomach longer than usual. This delayed gastric emptying can result in that persistent bloated feeling. If you're experiencing ongoing bloating without a clear cause, it's essential to consult with a healthcare professional. While it might be nothing serious, it's always better to be proactive when it comes to your health. Next, number 4, indigestion. Indigestion might seem harmless, but when it lingers or worsens, it could signal something more serious. In pancreatic cancer, tumors can press against the stomach or small intestine, disrupting digestion. This pressure may cause food to remain in the stomach longer, leading to bloating, nausea, or a burning sensation after meals. Research has shown that indigestion, even without accompanying heartburn, is linked to a higher risk of pancreatic cancer. A study published in BMJ Open found that individuals experiencing indigestion without heartburn had a 3.8-fold increased risk of developing pancreatic cancer compared to those without these symptoms. It's important to pay attention to persistent indigestion, especially if it's unresponsive to usual treatments or accompanied by other symptoms like unexplained weight loss. Early detection of pancreatic cancer can be challenging due to its subtle symptoms, but being vigilant about changes in your digestive health can make a significant difference. Next, number 5, diarrhea. When your pancreas isn't working right, it can mess with your digestion in a big way. One of the signs? Frequent loose stools that are hard to control. This happens because the pancreas makes enzymes that help break down fats, proteins, and carbs. If a tumor blocks these enzymes from reaching your intestines, your body can't absorb nutrients properly. The result? Food moves through your system too quickly, leading to diarrhea. A study published in the American Journal of Gastroenterology highlighted a case where persistent diarrhea was the only clue leading to a pancreatic cancer diagnosis. The patient had no other typical symptoms like jaundice or weight loss. This underscores how diarrhea, often overlooked, can be a critical warning sign. If you're experiencing these symptoms consistently, it's essential to consult a healthcare professional. Early detection of pancreatic issues can make a significant difference in outcomes. Next, number 6, fatty stools. You might notice your stool becoming pale, greasy, or floating. This occurs because the pancreas isn't producing enough digestive enzymes, leading to fat not being properly absorbed. As a result, the unabsorbed fat passes through your digestive system, causing these noticeable changes. A study published in the Nutrition and Clinical Practice Journal in 2024 highlighted that when over 90% of the pancreas's exocrine function is lost, fat malabsorption can lead to steatorrhea. This means that significant loss of pancreatic function can result in these stool changes. If you're experiencing these symptoms, it's essential to consult with a healthcare professional. They can perform tests to assess pancreatic function and determine the appropriate course of action. Early detection and management are key to addressing any underlying issues effectively. Remember, paying attention to changes in your body, even those that might seem minor, can make a significant difference in your health. Stay informed and proactive. Next, number 7, constipation. When the pancreas isn't functioning properly due to cancer, it can disrupt digestion. This disruption may lead to slower movement of food through the intestines, resulting in harder, drier stools that are difficult to pass. Pain medications, especially opioids often prescribed for cancer-related pain, can further slow down the digestive system, exacerbating the issue. A recent study published in 2024 in Frontiers in Oncology utilized Mendelian randomization analysis and found a potential causal relationship between constipation and an increased risk of pancreatic cancer, with an odds ratio of 1.56. This suggests that persistent constipation might not just be a symptom, but could also be associated with the development of pancreatic cancer. If you're experiencing ongoing constipation, especially if it's accompanied by other symptoms like abdominal discomfort or weight loss, it's important to consult a healthcare professional. Early detection and intervention can make a significant difference. Next, number 8, muscle wasting. In pancreatic cancer, this isn't just about shedding a few pounds. It's a profound, involuntary weight loss that primarily affects your muscles, leading to weakness and fatigue. What's alarming is that this muscle wasting can start even before a formal diagnosis is made. A study published in Nature Communications in 2023 found that skeletal muscle loss could be detected up to 18 months prior to a pancreatic cancer diagnosis. This suggests that muscle wasting isn't just a side effect, but could be an early indicator of the disease. Now, you might wonder, why does this happen? Pancreatic tumors release certain substances that disrupt the body's normal metabolism. One such substance is the pancreatic adenocarcinoma upregulated factor, or PAUF. Research has shown that PAUF can directly cause muscle cells to break down, leading to muscle atrophy. This isn't just about feeling weak. Muscle loss in pancreatic cancer patients is linked to poorer outcomes and reduced survival rates. It's a significant factor that affects not only the quality of life, but also the effectiveness of treatments. Understanding this connection emphasizes the importance of early detection and comprehensive care in pancreatic cancer. If you or someone you know is experiencing unexplained weight loss or muscle weakness, it's essential to consult a healthcare professional. Next, number 9. Pale or grayish skin. When the bile duct is blocked, bilirubin builds up in the bloodstream. This excess bilirubin can deposit in the skin, leading to a yellowish discoloration known as jaundice. In some cases, this may appear as a pale or grayish hue, particularly in individuals with lighter skin tones. This change in skin color is often one of the first noticeable signs of pancreatic cancer, especially when the tumor is located in the head of the pancreas. A study published in Clinical Gastroenterology and Hepatology found that jaundice and other bile duct obstruction symptoms, including pale-colored stools and dark urine, were common in pancreatic cancer cases and occurred more frequently among patients than control participants. This highlights the importance of recognizing changes in skin color as potential early indicators of pancreatic cancer. If you notice a sudden change in your skin color, such as a yellowish or pale gray hue, it's essential to consult a healthcare professional promptly. Early detection of pancreatic cancer can significantly improve treatment outcomes. Next, number 10, sudden onset diabetes. When someone over 50 is diagnosed with diabetes, it's often assumed to be type 2. However, in rare cases, this new diabetes may be an early sign of pancreatic cancer. The pancreas, responsible for insulin production, can be affected by tumors that disrupt this function, leading to elevated blood sugar levels. Research indicates that approximately 0.8% of individuals over 50 with new onset diabetes may have underlying pancreatic cancer. This risk is notably higher than in the general population. Notably, about 25% of pancreatic cancer patients were diagnosed with diabetes within 3 years prior to their cancer diagnosis. This suggests that, in some cases, the cancer may induce diabetes rather than the other way around. If you've recently been diagnosed with diabetes, especially after age 50, and are experiencing unexplained weight loss or other concerning symptoms, it's essential to consult your healthcare provider. Early detection of pancreatic cancer can significantly improve treatment outcomes. Next, number 11, blood clots. Blood clots can sometimes be the first sign of pancreatic cancer, even before any digestive symptoms appear. This phenomenon is known as Trousseau's syndrome, where clots form in unusual places like the arms or chest wall, often recurring or migrating to different locations. It's a result of the cancer creating a hypercoagulable state, making the blood more prone to clotting. A study published in Cancer Medicine in 2024 analyzed 4,086 patients with pancreatic cancer and found that 4.2% of those receiving palliative treatment experienced venous thromboembolism, or VTE, within a year before their cancer diagnosis. This suggests that VTE can precede the diagnosis and might serve as an early warning sign. Moreover, the presence of VTE was associated with worse survival outcomes, highlighting its significance in the disease's progression. If you or someone you know develops an unexplained blood clot, especially in the absence of typical risk factors, it's essential to consult a healthcare professional. Early detection of pancreatic cancer can significantly impact treatment options and outcomes. Next, number 12, itchy skin. In pancreatic cancer, persistent itching can be more than just a skin issue. It often signals deeper problems. This discomfort typically arises when tumors obstruct the bile ducts, leading to a condition called cholestasis. Here, bile acids and other substances accumulate in the body, irritating nerve endings and causing that relentless itch. Recent studies have shed light on this mechanism. A 2025 review in Quality in Sport highlighted that the enzyme autotaxin plays a pivotal role. Autotaxin increases levels of lysophosphatidic acid, a compound that activates itch-specific nerve fibers. This means the itch isn't just a surface sensation, but is driven by complex biochemical changes within the body. Traditional antihistamines often fall short in providing relief because this type of itch isn't primarily histamine-driven. Instead, treatments targeting bile acid accumulation or autotaxin activity, such as bile duct decompression or specific enzyme inhibitors, have shown more promise. Understanding this connection is crucial, as addressing the underlying cause can significantly improve a patient's quality of life. Next, number 13, fever. Persistent low-grade fever can sometimes be an early clue to pancreatic cancer, even when other symptoms are absent. In rare cases, the body's immune response to the tumor, without any infection, can trigger what's known as neoplastic fever. One documented case involved a patient with pancreatic adenocarcinoma who experienced fever as the primary symptom. After surgical removal of the tumor, the fever resolved completely within 4 days, and there was no recurrence during a 39-month follow-up period. This suggests that the fever was directly linked to the cancer itself. Additionally, a large-scale study analyzing Danish health records found that fever was among the significant symptoms reported in the 5 years leading up to a pancreatic cancer diagnosis. This indicates that, while uncommon, fever can be part of the symptom pattern associated with pancreatic cancer. If you're experiencing unexplained persistent fevers, especially alongside other symptoms like weight loss or fatigue, it's important to consult a healthcare professional for a thorough evaluation. Next, number 14, fatigue. Fatigue in pancreatic cancer isn't just about feeling tired. It's a deep, persistent exhaustion that doesn't improve with rest. Many patients describe it as a profound lack of energy that disrupts daily life. In a study conducted at a northern Italian oncology center, 94% of pancreatic cancer patients undergoing chemotherapy reported experiencing fatigue. This overwhelming prevalence highlights how common and impactful fatigue is in this patient population. Notably, older adults and women reported higher levels of fatigue. Factors such as anemia, significant weight loss, and smoking were also linked to increased fatigue levels. Fatigue in pancreatic cancer can stem from various sources. The cancer itself may produce inflammatory substances that disrupt normal body functions. Additionally, treatments like chemotherapy can exacerbate fatigue by affecting healthy cells and leading to side effects such as anemia. Addressing fatigue is crucial for improving quality of life. Interventions may include managing anemia, optimizing nutrition, and incorporating physical activity as tolerated. Healthcare providers should routinely assess fatigue levels and implement strategies to alleviate this debilitating symptom. Next, number 15, general malaise. Feeling persistently unwell without a clear reason? That vague sense of fatigue or discomfort, what doctors call malaise, might seem harmless. But for some, it's an early whisper of something more serious. A comprehensive study from Denmark analyzing over 25,000 pancreatic cancer cases found that general malaise and fatigue were commonly reported symptoms following diagnosis. These symptoms, often overlooked, were significant enough to be documented in clinical notes, highlighting their prevalence among patients. In a separate large-scale UK study, researchers observed that patients presenting with malaise had a 2.4 times higher likelihood of being diagnosed with pancreatic cancer compared to those without this symptom. This association underscores the importance of not dismissing general feelings of unwellness, especially when persistent. While malaise is a nonspecific symptom and can be attributed to various benign conditions, its persistence, especially in individuals over 60, should prompt further medical evaluation. Early detection of pancreatic cancer is challenging, but paying attention to subtle signs like prolonged malaise can make a difference. If you've been feeling unusually tired or unwell without a clear cause, it's essential to consult a healthcare professional. Early intervention can lead to better outcomes. Before we wrap up, let's take a moment to reflect. Staying informed about your health can truly make a difference. That's why content like this matters. Moving forward, if you found this video valuable or eye-opening in any way, go ahead and type "helpful" in the comments. It really encourages us to keep creating clear, science-backed health content just for you. And don't forget, sharing knowledge saves lives. Share this video with someone who might need it. Until next time, stay curious, stay proactive, and take care of your health, one insight at a time.